Blood clots form when blood cells and other components stick together. If untreated, part of the clot can break off and travel to the lungs. This is called a pulmonary embolism, and it can be potentially fatal if not detected early. Symptoms of a pulmonary embolism might include shortness of breath, chest pain while breathing, coughing up blood, or collapsing. You might also not have experienced any symptoms at all. Some factors might make it more likely for you to develop a blood clot. These include having been in hospital, having or undergoing cancer treatment, being pregnant or having had a baby less than 6 weeks ago, being immobile, which means bed rest, long distance travel, or having your limb in a cast or boot, a personal or a family history of blood clots, having had surgery less than 90 days ago, thrombophilia, some kinds of contraception containing estrogen, some types of heart, lung or inflammatory disease, being over 60 years of age, or overweight. The most common treatment for venous thromboembolism is through anticoagulation. These are medications that prevent clots from moving, growing or forming altogether. Treatment usually lasts for around 3 months, although this depends on your risk factors. You should keep taking your anticoagulant until your doctor or nurse tells you to stop. You shouldn't need specific blood tests, but you should attend your doctor for regular monitoring. If you're taking warfarin, you will require regular blood tests and monitoring. Treatment for clots is very effective and safe, and most patients can return to normal life as before. If you play contact sports, you should discuss this with your doctor to make a plan. Depending on the severity of the embolism, some direct treatments might be needed, but these are very rare and unlikely to be used. The main side effects of anticoagulant medication is an increased risk of bleeding. Make sure to contact your doctor if you notice heavy menstrual bleeding, unusual or extensive bruising, tiredness, or a very pale appearance. If you experience a traumatic injury, like hitting your head, or notice blood in your urine, stools, cough, or if you experience a bleed that won't stop, you must attend the emergency department. Remember, always tell your doctor or nurse you're taking an anticoagulant before any medical procedures or starting a new medication. If you experience side effects, do not stop taking them. Discuss this with your doctor or the team that commenced your medication. There are things you can do to speed up your recovery, such as taking your medication as prescribed, drinking plenty of water, and start physical recovery as soon as your doctor recommends, and remain active. Stop smoking. If you are using compression stockings, make sure that they're fitted to the correct size and worn appropriately. Look after your mind. It's important to know that it's normal to experience some feelings of anxiety in the weeks after being diagnosed with a pulmonary embolism. These feelings should improve within 3 to 6 months, and if they don't, please contact your doctor, nurse, or the Irish Heart Foundation.